My name is Leah, and I work at Saskatchewan City Hospital on an acute care surgical unit. We deal with gynae surgeries, orthopedics, shoulders, knees, hips, mastectomies, eyeballs, and jaws. And my job really is to, as people come in from surgery, is to assess how they're doing, because as we all know, there can be complications to a surgery. So we're looking for those different complications, whether it be infection, sepsis, embolisms, clots, blood loss, things like that. We're looking for that. And we're looking at their blood work as that comes up on a day-to-day basis to see where they're lacking in certain things. And if things do get to a point where they need intervention from the doctor, then that's what we do. We call the doctor, we get orders, if it means that we start an IV, if we hang blood, if we give a bolus of fluids. If it even becomes more serious and there has to be an outreach, we outreach that, do CPR. There's special staff that come on and do the IV pushes of certain medications to get things going for those people so that they live. So it's a very serious job in that aspect of having your head together and being there for the patients in that way. Also, working collaboratively with other healthcare professionals, be it PT, OT, the surgeon, maybe a medicine has to be consulted because they have other health issues. Working with them to see the success of this patient moving forward in their recovery is very important. And also being their advocate. Sometimes people come in and you just think, well, they're there for a surgery, but they have other family issues that they're dealing with. And so my job really on a daily basis is to advocate for those people. Maybe they don't have the money to buy certain things that they need after a surgery. So we put them in contact with services in the community or even right in hospital, whether it be social work or CPAS, to get them the things that they need so that their recovery is successful outside of the hospital. My favorite part of my job is meeting the patients and their families, and not just, assessing or just being that nurse, but really being that advocate for them. Lots of people come into the hospital and they have no one. And so to think that I would be the only person that would be there for them, I take it very seriously, and I make sure that they get every service they need. Whether I got to phone 5 times to make that happen, I will. And I find that rewarding to see that come together for that person. In my career in healthcare so far is the cutting of certain services and privatizing them. And really the outcome of it has been disastrous. Like when you think of even just something as simple as our linen services, and we just don't have the linen that we used to have. And we have to walk literally miles to go and get this linen because it's not available. Who doesn't want a clean bed? Who doesn't, these people go through a lot. They need to feel good about themselves, and one way is just through cleanliness, through our linen, and even our food services. When you're going through a surgery or a hard time, who doesn't want to have a good meal? And here that's been cut too. So you feel the effects of that, and then as nurses, we have to compensate. That's what it feels like, and it can be very exhausting at times to compensate for those other areas.
I'm Janice Platsky, Treasurer of SEIU West. We want you to know the full value of what our members bring to the healthcare team. They are an essential piece. But every day they face higher workloads and short staffing. Together, let's send a message to government. Stop the cuts to our healthcare. United by one union, SEIU West, and one color purple, we ask, please share this video and visit our action page.